1 in 8 men will be diagnosed with prostate cancer in their lifetime. And here's the part that should stop you cold. Most of them had a completely normal PSA test the year before. Not a borderline result, not a "we should watch this." A normal result. Filed away. See you next year. So what went wrong? Here's the answer most doctors won't give you in a 5-minute appointment. The PSA test, the way it's being used right now in clinics across this country, was never built to catch the men who need it most. And there are 3 specific things your lab report is not showing you. 3 things that change everything about how you read that number. I'm not here to frighten you. I'm here to hand you something useful. Because the men who catch prostate problems early, they're not lucky, they're informed. And by the time this video is over, you will be too. Stay with me. What I'm about to share in the next few minutes, your doctor knows it. He just may not have time to explain it. Hi, I'm Dr. Hannah Blake. I've spent years working with men over 50 who come to me saying the same thing. I keep getting told everything is fine, but something doesn't feel fine. That gap between what the test says and what a man actually feels is exactly what this channel exists to close. Today we're going deep on the PSA test, what it actually measures, what it consistently misses, and the exact questions you need to bring to your next appointment to get real answers instead of a nod and a number. As always, everything here is educational. Please work with your own doctor before making any decisions about your health. Now let's get into it. Picture this. You're 58 years old. You went in for your annual physical. The blood work comes back. Nurse calls and says, "Your numbers look good." You exhale. You move on. You stop thinking about your prostate for another 12 months. Now picture a different scene. Same man, 6 months later. You're up at 2 a.m. Third time this week. The stream is slower than it used to be. There's a hesitation before things start that wasn't there 5 years ago. And there's a quiet worry sitting in the back of your mind that you haven't said out loud to anyone. Not your wife, not your doctor, not your closest friend. But the test said fine, so you stay quiet. Here's what I want you to hear. You're not overreacting. Your body is sending a signal. The question is whether the tool you're using to listen to it is actually capable of hearing it. The PSA test, prostate-specific antigen, is one of the most widely ordered and most widely misunderstood screening tools in modern medicine. Major medical organizations have debated it for decades. Urologists argue about it at conferences, and the average man over 50 has no idea any of that debate is happening. He just knows the nurse said fine. Here's the myth most men are operating under. High PSA equals cancer. Low PSA equals safe. Simple. Here's reality. A man can have a perfectly normal PSA and carry aggressive prostate cancer. A man can have an elevated PSA from a long bike ride, or intimacy the night before, or a mild infection he didn't even know he had. Both of those scenarios play out in clinics every single day. And the consequences of getting this wrong, they're not small. Some men receive aggressive treatment for cancers that would never have caused them a single symptom. Other men receive false reassurance for years while something quietly grows. Both outcomes are preventable. Both happen because a complex picture got reduced to a single line on a lab report. This isn't just a medical issue. It's a confidence issue, a sleep issue. It's the thing you don't bring up at dinner, the thing you carry alone because you don't want to be the guy who panics over a normal test. But here's the truth. And I want you to hold on to this. Aging and neglect are 2 completely different things. And what I'm about to show you is how to tell the difference. Let me show you how this test actually works, because once you understand the mechanism, the 3 things that change everything will make complete sense. Your prostate is a small gland sitting just below your bladder. It produces fluid. That fluid carries proteins. One of those proteins, PSA, prostate-specific antigen, leaks into your bloodstream as a normal part of how the gland functions. The PSA test measures the level of that one protein in your blood at the exact moment they drew the sample. Now here's the sentence I want you to remember from this entire video. PSA is not a cancer marker. It is a prostate activity marker. Anything that irritates, inflames, enlarges, or stimulates the prostate raises PSA. Cancer does it. But so do a dozen other things that have nothing to do with cancer. The test tells you the prostate is active. It cannot tell you why. Mechanism 1. Benign prostatic enlargement. After 50, the prostate naturally grows in most men. More tissue means more PSA. regardless of whether anything is wrong. A healthy 65-year-old with a large but perfectly benign prostate can have a number that looks alarming on paper. This is exactly why age-adjusted PSA ranges exist. A flat cutoff, same number for every man, every age, was always going to miss this. Mechanism 2. Inflammation. Prostatitis, inflammation of the prostate, can send PSA levels spiking dramatically. Sometimes the man has a low-grade infection he's completely unaware of. He gets tested, panics at the number, gets retested 6 weeks later after the inflammation clears, and the number is back to baseline. This happens constantly. Most patients are never told it's a possibility. Mechanism 3. Velocity. This is the one that changes everything. The single most predictive signal for aggressive prostate cancer is not the absolute number on any one test. It is how fast that number is changing over time. This is called PSA velocity. A man whose PSA was 2.4 last year and is 2.5 this year is in a fundamentally different situation than a man whose PSA was 1.0 last year and is suddenly 2.5 today. Same number on the report, completely different story underneath it. Almost nobody sitting in a clinic waiting room knows this. Mechanism 4. Free PSA versus total PSA. PSA travels through your bloodstream in two forms, bound to other proteins and freely circulating on its own. The ratio between these two forms is diagnostically powerful. A lower percentage of free PSA correlates with higher cancer risk. A higher percentage suggests the elevation is likely benign. This is a test your doctor can order, but it isn't part of the standard panel. In most cases, you have to ask for it specifically. Your PSA number on its own is almost meaningless. What matters is the trend, the ratio, and the context around when it was taken. Nobody is explaining this in a 5-minute appointment, and that gap is costing men years. The men who catch problems early are not the men with the lowest numbers. They're the men who track the trend, ask the follow-up questions, and treat every screening as a data point in a longer conversation, not a verdict. Everything we've covered so far is the why. Now let's talk about what you actually do. 7 things, starting at your very next appointment. I'm going to move through these efficiently, and I've saved the one most doctors never volunteer for last. Fix 1. Get your actual number, every time, in writing. Normal is not a number. You cannot track normal. Request the specific value. Write it down. Keep a running record. Notebook, phone note, doesn't matter. 3 consecutive years of PSA numbers tells you something real. A single result tells you almost nothing. I had a patient, early 60s, who'd been tested every year for a decade and never once knew his actual values. When we finally pulled his full history together, we saw a slow, steady climb that had been happening for 4 years. Nothing alarming on any single visit, unmistakable as a pattern. That trend completely changed his monitoring plan. Fix 2. Ask about velocity. Use that exact word. Sit down with your doctor and ask, how is my PSA trending over time? Not, is it normal? Trending. That one word moves the conversation from a snapshot to a story. It signals that you understand this is a longitudinal measurement, and it changes what your doctor pulls up to answer you. Fix 3. Ask about the free PSA ratio if your number is in the gray zone. If your total PSA falls between roughly 4 and 10, the borderline range, the free PSA ratio can give you and your doctor substantially more information before any decision about further testing. It's a simple blood draw, widely available, almost never ordered automatically. Ask for it by name. Quick pause. Drop a comment below and tell me where in the world you're watching from. It genuinely means something to see men taking this seriously from every corner of the map. All right, 4 more. Fix 4. Time the test right. Vigorous cycling, intimate activity, recent urinary infections, or a recent prostate exam in the 48 hours before your blood draw can all elevate PSA temporarily. Mention anything relevant to your doctor before the draw, or reschedule. A spike from a Saturday morning bike ride can set off weeks of unnecessary follow-up and real psychological cost. Fix 5. Don't skip the physical exam. The DRE, the digital rectal exam, catches structural changes the PSA number cannot detect. The PSA catches biochemical changes the DRE cannot detect. They are not interchangeable. They are complementary. Skipping one because you had the other is leaving half the picture blank. Fix 6. Know your family history and say it out loud. First-degree relatives with prostate cancer, particularly before age 65, changes your screening timeline and intensity. African American men carry a meaningfully higher baseline risk and benefit from earlier, more attentive monitoring. Don't assume this is in your file. Many electronic records are incomplete on family history. Put it on the table yourself. Fix 7. Have the "what's next" conversation before you ever need it. This is the one most doctors never raise. At your next appointment, when everything is calm and there's no elevated number on the table, ask this. If my PSA were to rise above a certain level, what would the next step look like? And what would we be watching for? Most men only have this conversation in a state of fear, after an alarming result comes back. Fear is a terrible decision-making environment, but if you've already had this conversation, when you're calm, thinking clearly, operating from curiosity rather than panic, you'll already know that options exist. MRI imaging before biopsy, genomic risk profiling, active surveillance protocols. These are real, available options that most patients discover only under duress. Knowing them in advance puts you in the driver's seat before the road gets difficult. We're not done. What's coming next? Most videos on this topic skip it entirely. Stay with me. Before the story, I want to stop and name 3 mistakes directly, because knowing what not to do is just as important as knowing what to do. Mistake 1. Treating a single number as a verdict. One elevated result is rarely a diagnosis. One normal result is rarely a clearance. The right response to almost any PSA result is repeat the test in a few weeks, place it against the trend, and make decisions from a pattern, not a moment. Calm, methodical thinking consistently outperforms fast, reactive thinking in this conversation. Mistake 2. Deciding not to test at all. The PSA test has had a complicated decade in the public conversation. There are real, legitimate concerns about overtreatment. But refusing to screen isn't the answer. Smarter screening is. The men who avoid testing entirely sometimes discover problems years later than they needed to. That gap costs more than a conversation would have. Mistake 3. Going quiet in the appointment. Most men over 50 were taught, explicitly or implicitly, that you don't question the person behind the desk in a white coat. That era is over, and the men still living by those rules are paying for it in information they never receive. The best appointments are the ones where the patient comes in with 3 questions written down and leaves with 3 answers written down. Doctors respect this. The patients who get the best long-term outcomes are almost always the ones who engage. Let me ask you something. Have you ever walked out of a doctor's appointment and remembered 10 minutes later the thing you forgot to ask? Drop it in the comments. I read every one. I want to tell you about a patient I'll call Frank, 64 years old, retired electrician from Ohio. A good man, the kind who fixes things with his hands and doesn't talk about problems until they can't be ignored. The kind who only sees a doctor when his wife schedules the appointment. Frank had been getting PSA tests for 10 years. Every year, same response from his doctor. Looks fine. Frank never asked for the number. He trusted the word. He went home. Then one summer, his brother was diagnosed with prostate cancer. And Frank sat in my office and said something I've heard more times than I can count. I realized I don't actually know what my own numbers have been. We pulled his full history, and what we saw, sitting there together, was a slow and steady upward trend that had been moving in the same direction for 4 years. Nothing that would have triggered alarm on any single visit. Everything that should have started a conversation much earlier. Here's what Frank did, and this is the part that matters. He didn't panic. He didn't spiral. He started doing 3 things. He began recording his actual PSA number every time it was drawn, in a small notebook he keeps in his kitchen drawer. He asked his doctor for a free PSA test, which gave us substantially more information than the total number alone. And he had the "what's next" conversation, calmly, from a position of information rather than fear, so he knew exactly what the monitoring plan looked like going forward. No dramatic medical event followed, no crisis, no miracle moment. What Frank got was something rarer and more durable than either of those things. He got clarity. He knew what his numbers meant. He knew what direction the trend was moving. He knew what to watch for, what to ask, and what the options were if anything changed. The last time I saw him, he said, and I've thought about this a lot since, he said, "Doc, for the first time in 20 years, I don't feel like I'm just guessing about my own body." That's what this is about. Not a cure, not a guarantee. A man who knows what's happening inside him and knows what to do about it. Let me bring this together. The PSA test is not a cancer detector. It's a prostate activity signal, and one number, on one day, with no context, was never enough to give you a real answer. What actually matters is the trend over time. The ratio of free to total PSA, the circumstances around when the test was taken, and the conversation you're willing to have with your doctor about all of it. The 7 things you can do starting now. Get your actual number in writing. Ask about velocity. Request the free PSA ratio if you're in the borderline range. Time the test correctly. Pair it with a physical exam. Put your family history on the table and have the what's next conversation before you ever need it under pressure. The 3 mistakes to avoid. Treating one result as a verdict, skipping screening altogether, and going quiet when you should be asking questions. You're not slowing down. Your body is asking for a different kind of attention. And now you know exactly how to give it that. Talk to your doctor. Come prepared. Bring your numbers, your trend, your history. And remember, a doctor worth having will welcome every question you bring through that door. If something in this video hit differently than what you usually hear, hit the like button. It tells YouTube this information is worth putting in front of more men who need it. I publish every Tuesday and Friday. Real, practical men's health information you can actually use in a real appointment with a real doctor. Subscribe and tap the bell. Don't miss what's coming. And now I want to hear from you directly. What is one question about your prostate health, or your PSA specifically, that you have never asked your doctor? Not because you didn't care, because the moment never felt right, or you didn't want to seem worried, or you weren't sure how to bring it up. Drop it below. No judgment. Every comment gets read. My next video, and I want you to pay attention to this one, covers something almost no channel in this space is talking about yet. The connection between how often you're waking up at night to urinate and what's actually happening to your hormone levels after 60. It's not what most men assume, and once you understand it, you will never look at that 2 a.m. wake up the same way again. I'll see you Tuesday. Take care of yourself.